Parkinson's disorder generally ignored till it becomes severe and till the patient really shows the fibrillations, and they might fall twice or thrice. Then only it will be addressed by a neurologist or a family member identifying that it could be a major problem. And by the time we need to understand that it has gone little severe, and they might need to use a lot of tablets and surgery called deep brain stimulation. In case if certain symptoms can be identified early by family members or the person by themselves, then the Parkinson's disorder can be at least stabilized or prolonged with the same symptoms for longer time. So how can this be identified? Early, in case of any shivering at the voice level while they're speaking, or they're unable to eat properly, or their steps while they're walking, they have mis coordination while they're walking. They're not able to walk on the straight line, and inability to do a complex command, or continue to show attention to a particular skills. So these kind of problems might lead to Parkinson's disorder much earlier. So a simple MRI scan or explaining these symptoms to a neurologist can help you identify PD or the Parkinson's disorder much earlier. So by identifying the Parkinson's disorder much earlier, what better we can do? We can try multiple attempts or multiple techniques used by a physiotherapist and by medication or by a speech therapist to avoid further severity of the Parkinson's disorder, and we can also avoid further severity of the shivering for the person to communicate or express their feelings or speech skills. So, in case the speech therapist or a neurologist can identify Parkinson's disorder much earlier, the techniques which can be used are by improving the muscle strength, improving the coordination of the movement between the oral structures, and the cognitive skills in the brain, and continuity of the skills. For example, the moment Parkinson's disorder is identified, they might go under depression or demotivate themselves to speak or do anything. And they need lot of attention and lot of energy to do one single task. So these things can be changed, and make sure that they are motivated by doing simple tasks much easier. So once they are able to, we can show that they are able to do simple tasks, then they will be more motivated to do more complex tasks very easily. And also by improving the muscle strength, their fluency of speech will be much better, and they will be able to communicate with lot of people. By communicating with lot of people, they are more active cognitively, and their memory increases, and also their attention increases. The moment they are not communicating with the opposite person, and they're finding it very difficult or demotivating to talk to people, their memories will go down, that is dementia, and they will not be able to show a lot of attention to even one small sentence. So these kind of problems will make them feel aloof, and slowly their daily activities like even bathing, dressing themselves, fine putting their shirt buttons, all these things also will be affected, and they will need lot of help or support from the family members to do minimum daily activities. That will again hinder their motivation, and it will lead to lot of depression. Even the tablets might not work once they are under depression and demotivation. So we need to address these problems much early with the help of speech therapists or a physiotherapist to encourage their muscle strength and motivate them to speak with lot of coordination. So speech therapy is also very important for a patient or a geriatric population who was diagnosed as a Parkinson's disorder patient.